on maternal health and what it takes to get healthy enough to be a mother, the process as you're waiting to become a mother, and then afterwards, what are some things to keep in mind post-baby to keep you in the best shape and keep you healthy so that you can continue to care for that baby. So we're going to start out with Shelby and talking about exercise before pregnancy.
All right, yeah, like Eva said, we're going to touch on, start out before you even become pregnant, because being healthy before you conceive will give you a better chance at getting pregnant in the first place, having a smooth pregnancy, healthy delivery, and a healthy baby. A mother's health has a direct correlation with her baby's health and is especially important during the critical stages of early fetal development. Even before you even know you're pregnant, it's so important. And as we're learning even more, and on past webinars we've mentioned this before, it could even affect your baby's health. So, you know, being healthy before you even conceive is very, very important. I'm just going to touch on exercise first. A lot of women tend to shy away from exercise while they're trying to get pregnant because they think somehow it will hinder their ability to conceive. In the vast majority of cases, this is absolutely not true. If you're already active now, stay active. If you are not active, there is no better time to start. Like I said, it's going to benefit you and your baby to be in top physical shape when you become pregnant. And it could also help you get pregnant faster. A study in the journal Obstetrics and Gynecology concluded that women who exercised 30 minutes or more daily, which is the recommendation, had a reduced risk of infertility due to ovulation disorders. So if you're healthy and active, your chances of conceiving go up. It's as simple as that. The only thing you do need to watch is just the amount of vigorous activity, as some data does link too much of that activity to lowered fertility. But it's pretty hard to get that much of vigorous activity for the normal person. I mean, this is something like running a bunch every day or doing very, very heavy lifting, things like that. A typical person's not going to do that, so you don't have to be concerned about it at all. So like I said, a good guideline is to make sure you're getting at least that 150 minutes weekly of moderate activity in. Moderate means get that heart rate going, get it pumping, get it working. Building up that endurance now with your heart rate will help the endurance you need during labor and delivery. We all know that that's the hard part, so starting now is going to keep things in good shape for you. And really any type of activity is okay at this point, so just do what you like and get moving. Think about more than cardio too. You're less likely to have back pain during later stages of pregnancy if you strengthen your core and your back right now. You will also have better balance and posture, which is very, very important during pregnancy to prevent injury. Also, just making a good habit right now, you'll be able to stick with that routine when you're in the later stages of pregnancy, and when you aren't necessarily the most comfortable or have the same amount of energy, you're in that habit and you're going to be more likely to do that and kind of, you know, still be active, even if it's not at the same level for you.
All right, so nutrition for fertility. Basically, to sum it up, it's going to be low in sugar and high in healthy fat. Those are two things that really, really help get your hormones regulated. One reason when you have a lot of sugar in your diet, you're secreting a lot of your insulin hormone, and that leads to hormone disruption in other areas, which makes it hard to conceive. But basically, stock up on your fiber. Vegetables are the best source. Studies have shown that fiber supplements, fiber bars, any of those fiber, kind of fake fiber is what I like to call them, but fiber supplements like that don't actually impact your body the way that fiber from vegetables and fruits does. So they're not as beneficial. They usually come with extra junk that you don't need, so stick with your veggies and fruits for fiber. B vitamins, your shellfish, your liver, your fish, your beef, and your dairy. Beef is probably the best way to get that B vitamin. If you're a vegetarian, it can be tough to get enough of that B vitamin, so make sure that you are supplementing. Not a big red meat eater, same thing. Make sure that you are supplementing to get that. Vitamin E, sunflower seeds, almonds, spinach, avocado, asparagus. Vitamin C, we always think oranges, but oranges are actually one of the least prominent for that vitamin C. Papaya is the top, but bell peppers are awesome, broccoli, Brussels sprouts, and all of those things are going to have fiber in them. So you can kind of double up on some of these, and you're killing a lot of birds with one stone. Zinc is also very important for fertility. Beef, again, if you are a vegetarian, try to take a zinc supplement. lamb, lentils, garbanzo beans, those are good for vegetarians as well. Some more just to go over here, iron, calcium, folate, folate and not folic acid, which I'm going to touch on a little bit more, which is something we've talked about before. Choline, egg yolks is the best source of choline. Eggs are one of the healthiest foods you can eat, especially as you prepare to try to get pregnant. There are a lot of benefits to what's in there for your body to get those hormones regulated. Protein, you got to have your protein. So as much as possible, stick with that protein and healthy fats, keep the sugar low. Avoid the refined carbohydrates and refined sugars. Like I said, that leads to hormone disruption. Really, really, really stay away from MSG, aspartame, saccharin, sucralose, any of those artificial sweeteners or artificial flavorings. And I would go so far as to say, for your own sake, artificial colorings. And then synthetic fats. So canola oil, vegetable oil, corn oil, sunflower oil, soybean oil, keep that low. Limit caffeine. Caffeine can change how your hormones work. Not a huge deterrent, but definitely does play a part. Basically, eat whole foods. So again, if you've joined us on past webinars, Shelby and I talk a lot about getting anything packaged out of your diet, and it definitely goes for your fertility as well.
All right, so here we go. You've gotten pregnant. Now what? This is not an excuse for a free-for-all. Yes, you're going to gain weight. Yes, you will need to rest more, but you are not doing yourself any favors by sitting on the couch for 9 months. Here are some reasons you should continue that exercise throughout your pregnancy. First of all, it's going to boost your energy. Pregnancy can sap that energy, but regular bouts of exercise will help you get through those daily tasks or cope with a demanding schedule. Exercise strengthens your cardiovascular system, as we know, so you won't tire as easily. And with strong muscles, you will need less effort to engage in the activities that you do, whether that's grocery shopping or sitting in meetings in the office. It's just going to benefit you throughout that whole pregnancy. It's going to help you sleep better. When you're carrying that extra weight in front of you in that belly, finding a comfortable sleeping position can be really tough. I know I had lots and lots of pillows during mine. But exercise will help you work off any excess energy and tire you enough to hopefully lull you into a more restful sleep. It'll reduce pregnancy discomfort. Overall, regular exercise stretches and strengthens your muscles, which helps your body cope better with the aches and pains of pregnancy. Some examples: stretching eases your back pain, walking improves your circulation, and swimming can help strengthen those abdominal muscles without putting too much stress on them. It can prepare you for childbirth. Simply as that. Oh, I skipped one. Prevention of health problems like preeclampsia, gestational diabetes. Those are issues that we know are prominent. But if you're in better health, if you're exercising, you're going to hopefully have less of a chance of dealing with those types of things. So again, next one. Just be prepared for the actual childbirth. It makes sense. The better shape you're in, the stronger you'll come into labor and delivery time. Though it hasn't really been researched that much, training for childbirth through exercise, it makes sense. It eases labor and could even shorten the time it takes you to deliver your baby. Again, I know that I felt like that was in my case. I was in good shape and my labors didn't last for very long. And again, everyone's different, but it'll give you a better chance of having a shortened delivery time. It's just good for stress reduction and can lift your spirits. Having a child, we know, is a life-changing experience and can leave you feeling happy, overwhelmed, anxious, all at the same time. As we've mentioned in previous webinars, one study found that exercise boosts levels of serotonin, which is a brain chemical linked to mood, which will put you in better spirits, again, dealing with all the stress that you're going to be under during that pregnancy. It'll improve your self-image. Let's face it, nobody likes the scales going up, even if we know the reason you're growing. Reason why is because you're growing a human being in your belly. Staying active helps keep you feel better about your self-image and improves your odds of gaining a healthy amount of weight instead of maybe more than you should be. And also, it's going to help you get your body back faster after childbirth. This alone is motivation enough for many women to do that pregnancy exercise. When you've maintained your strength and muscle tone all the way through pregnancy, your body will have an easier time bouncing back after you give birth. You'll also, again, gain less surplus weight if you exercise during that pregnancy. And last but not least, certainly not least, your children tend to be healthier if you exercise during pregnancy. Just one example of this is that their hearts tend to be more efficient, and that actually tends to stick around during childhood years. There's so many benefits to your children with being active through pregnancy. I obviously didn't touch on very many, but know that there's very, very many. So we know there's fantastic benefits of exercising while you're pregnant, but you also need to be aware of how your body will change in regards to how it responds to exercise. So just be mindful of the following things. Breathing. You need more oxygen when you're pregnant, especially if you're in your second and third trimester. Your belly puts pressure on your lungs, making them work harder in a smaller space. And you could find yourself feeling short of breath at times. So just be very mindful of that when you're exercising, and don't go too hard if you're having some of those symptoms. Heart rate. Your heart has to work harder, and it beats quicker during pregnancy to get oxygen to your baby. So you may have a little less energy. Again, we've talked about this, but just staying active can help maintain those energy levels for you. Body temperature. You will start sweating sooner than you did before you were pregnant. This protects yourself and your baby from overheating. So your body's going to put in those modes before it normally would. So you may find you just start walking for a few minutes and you're already sweating. That's a protective measure that your body's doing. It doesn't mean that you should stop. It just means that it's just helping your body with the exercise that you're doing. Balance. As your body changes during pregnancy, so does your sense of balance. And you may notice that you lose your balance more easily because your center of gravity changes because we're adding weight in different areas of your body. So something to be aware of. But again, if you're exercising regularly, you can compensate for that with having those strong muscles to keep that balance. And then your joints. Your hormones, which are chemicals, in your body, are at high levels during that pregnancy, and it can make the tissues in your body more relaxed. So just try to avoid any movements that can strain or hurt your joints when you're doing that exercise. Just be aware, know your body, don't overdo it, but just stay active. So, just as you want to be active during pregnancy, which might come as a bummer. You don't get to kiss your feet up for 9 months, but she's right. You're going to be in a lot better shape coming out of it. Same thing, we want you to be mindful of your nutrition habits, probably especially while you're pregnant, because you're not just affecting your health, you're affecting the health of your baby. And so I'm going to break the bad news to you. You can't eat for two. It just is not good. It's not going to lead to healthy weight gain. And when you're overweight, when you deliver your baby, it is a lot harder to bounce back. So keep this in mind. That being said, pregnancy is not the time to diet and restrict calories, but it isn't the time to overdo it too much either. So recommendations vary. They say 15% increase, or about 300 calories a day is a healthy way to go, especially in your second and third trimester. So maybe in the first trimester you don't need as much, but in that second and third, there's a lot of development happening. So in this case, you want those 300 calories to come from nutrient-dense foods. This means getting the whole foods that we talked about, vegetables, fruits, proteins, and healthy fats. There's a couple especially that you can find either in a prenatal supplement or in food itself. So folate, again, folate, not folic acid. Folate is something that helps prevent neural tube defects in developing babies. So that is why it is such a serious inclusion, and why it's a big recommendation, why it's in a lot of fortified foods. Iron, obviously, is a great one. Iron helps with red blood cell production to prevent anemia in you and your baby. There's another place you can get it from. Beef typically is a nice source, other meats, or in a supplement if you need to. Vitamin A is good for healthy skin, good eyesight, and growing bones in your baby. Protein is very important for your cell growth, the baby cell growth, and blood production. And also, omega-3 fatty acids are really important to brain function in the baby. And then I would just say look for a high-quality prenatal supplement. And when I say high-quality prenatal supplement, one of the ways you can test that is to
check out whether it has folate or folic acid. This is something that we talked a little bit about in a past webinar. Folate is the general term for vitamin B. It occurs naturally in foods. Here's a list of foods, lots of vegetables, which again are going to help with a number of other things. Folic acid, however, is found in a lot of fortified foods. It's found in some lower quality supplements. And what it is just a synthetic supplement for folate. Unfortunately, about 50% of the population isn't able to tolerate folic acid and actually has health risks associated. One of the biggest things it does is mask the detection of a B12 deficiency. So if you are deficient in B12, any test coming back won't let you know that. You'll suffer from the risk of being deficient in B12, lower energy. You miss out on some stuff. Faster rate of cognitive decline associated with folic acid and a higher rate of anemia. And just as in B12 anemia, a lot of times the things that you need would be red meat. But avoid folic acid when you're looking at your supplements. Look for folate. If it has folic acid, put it down. Find one that has folate. If it has folate in it, it's probably a brand that pays attention to quality. So just by default, that supplement's going to be a little bit better. Some things to avoid during pregnancy. Soft cheeses. A lot of these recommendations are because of foodborne illnesses that can put you at risk, put that baby at risk, and possibly lead to miscarriage or other complications. So really, really want to be careful. So soft cheeses, alcohol, raw eggs or raw egg products, fish. There's the mercury risk, and with raw fish, issues with foodborne illness again. Any of the salads that you find pre-made at the grocery store, chicken salad, ham salad, egg salad, that's stuff you want to probably make on your own just because of the foodborne illnesses associated with that sitting out. Raw shellfish, again, any kind of raw fish is going to be something to watch out for. Raw or undercooked sprouts. So I'm telling you to get lots of vegetables. Sprouts actually a lot of times are a source for E. coli and salmonella, so know where you're getting it, kind of know what's going on. Artificial flavorings and colorings. This is a big one for preventing issues, especially development issues for your children later. And then caffeine. Want to keep that caffeine low and really be careful. I think it was two 5-ounce cups a day was the recommendation. So not much for coffee. I know that's a hard one for a lot of women, but the important thing is to keep that baby healthy. All right, so you've delivered that baby, everyone's happy, everyone's healthy, hopefully, and they're obviously going to be your top priority, and you need to give your body time to rest, but pretty soon you're going to need to start thinking about getting some movement in again. Similar to the benefits we see before and during pregnancy, postpartum benefits are numerous. It promotes weight loss, it helps get that cardiovascular fitness back up to par, it helps restore your muscle strength, it helps to recondition your abs, it boosts those energy levels up, which you will need with some of those sleepless nights. It can improve your mood and relieve that stress as well, which can help it prevent and promote recovery from postpartum depression, which I'm going to touch on here in just a second. And it sets an example for your child. If they see you active throughout their younger years, they will grow up and make that a part of their life as well. So how long should I wait? In the past, healthcare providers have often instructed women to wait at least 6 weeks after giving birth to begin exercise, but those restrictions are slowly changing. If you had an uncomplicated vaginal delivery, it's generally safe to begin exercising as soon as you feel ready. If you had a C-section, extensive vaginal repair, or a complicated birth, talk to your healthcare provider about when to start exercise. And again, even if you had an uncomplicated delivery, make sure you're checking with your doctor, just like you would during your pregnancy, to make sure that there's nothing that they don't want you to do. So for most healthy women, all right, for most healthy women, the recommendation is 150 minutes a week of moderate intensity aerobic activity. So again, we're similar to before and really during pregnancy. So consider the guidelines that we've got here. Take time to warm up and cool down. Start simple. Walking is an easy option to get back on pace.
Begin slowly, increase that pace gradually. Drink plenty of water. Fluids, it says on here, water is obviously the preferred. Wear a supportive bra if you're breastfeeding, nursing pads, just to make you feel more comfortable and catch any leaks if that's the case that comes up. Avoid excess fatigue and stop if you feel pain. Again, it comes back to knowing your body and just being mindful because your body has gone through a lot of stress, and we just need to be careful. So when you're ready to exercise, start with something low impact and simple like walking, like I said. And with your healthcare providers, okay, consider a couple of these specific exercises for women after pregnancy. First one is the pelvic tilt. You want to try this a few times a day to strengthen your abdominal muscles. So what you do, you lie on your back on the floor with your knees bent, flatten your back against the floor by tightening those abdominal muscles and bending your pelvis up slightly. Hold this for 10 seconds and just repeat for 5 times and work up to 10 to 20 repetitions. Again, this is an easy, low-impact way to start building those abdominal muscles that have been stretched and strained. Another one, Kegel, however you want to say it. This is going to tone your pelvic floor muscles, which support that uterus, bladder, small intestine, rectum. Basically, what you want to do is you want to contract the muscle that you use to stop your urine flow. You want to hold this for up to 10 seconds, and then release, relax for about 10 seconds between the next one, and then aim for about 3 sets of 10 per day. Again, these are muscles that get stretched, they get strained during pregnancy, and we really need to work on this just for incontinence, things like that, to make sure that we get things back on track. So keep in mind, those hormones I mentioned before that loosen your joints will affect you for about 3 to 5 months typically after you're pregnant still. So be very careful not to stretch too far, injure yourself. Another condition to be aware of is diastasis recti or recti. This is a gap in the abdominal muscles during pregnancy and labor. So if you have this, you should have 48 weeks of recovery to reduce the risk of injury. So something to be aware of. You can actually check this yourself to see if you've still got that little gap. What you can do is you lie flat on your back with your knees bent, similar to that pelvic tilt. You want to place your fingers of your left hand with the palm facing you, facing your belly, just above your belly button, your right hand on your upper thigh. So inhale and then exhale. As you exhale, lift your head and shoulders off the floor, slide that right hand towards your knee to tighten those abs. You should feel a little gap there if there is one. It's just kind of like a hole between your abs there. So again, if you're feeling that, you're going to need to wait a little bit longer to do any big ab exercises. So again, just do what you can. When you're caring for a new baby, finding time for physical activity can be challenging. Hormones and emotions may get the best of you sometimes. Some days you just might simply feel too tired to do a full workout. That's okay. But that doesn't mean that you should put physical activity on the back burner. Just, again, do what you can. Seek the support of your family, family or friends, anybody. Schedule that time for physical activity, exercise with a friend to stay motivated. Include your baby. Go for a walk when they're in the stroller. Lie next to them when you're on the floor doing some tummy time while you do some ab exercises when you're healthy again to do it. Just do what you can. Don't stress yourself out, but again, it's going to make you feel better if you stay active during the early stages after pregnancy as well.
All right, so nutrition post-pregnancy goes for everybody, but especially when you're breastfeeding, you're going to need more calories. So if you're trying to lose the baby weight, it can be tempting to cut down, but you're gonna sap all that energy. You're not going to be able to go for walks with that baby in the stroller. So you want to make sure that you're eating enough to maintain that milk production if you are breastfeeding. Again, nutrient density. What you're putting in your body is still finding its way into your baby's body. So lots of things you want to be aware of. Quality whole foods, again, nutrient-dense foods, foods that you know are good for you. If you change the types of foods that you're eating day to day, that's going to introduce different flavors for your baby. So your milk changes with what you eat, and that can be a good thing or a bad thing. You might find out what the baby likes and what the baby doesn't like. A lot of times they encourage you to continue with that prenatal supplement to support all the nutrients that you need and might not be getting from food. Stay hydrated. This is a huge one. I remember when my aunt first gave birth to my little cousin, I couldn't believe the amounts of water she could drink. because it just blew my mind. But she needed that water to continue to stay hydrated for herself, continue that milk production. So drink before you even feel thirsty. A lot of times if you need it, if your urine is dark yellow, you got to drink a lot more water. And you know, when we talk about increasing fluids, we mean water. You can make your own decaf herbal teas, things like that, but avoid juices and other sugary beverages for your sake and for that baby's sake. Lots of iron, protein, and calcium, especially protein. 35% more protein is recommended for breastfeeding women. Healthy fats, so coconut oil, butter, avocados, things that, again, help with the hormone regulation. You still got a lot of hormones surging around, so you want to make sure you're optimizing what's going on in your body. Coconut oil also really helpful with thyroid. Thyroid really important for your energy and some of that post-baby weight loss. So coconut oil is a really good healthy fat to include. Still got to limit caffeine. Kind of a bummer, but that caffeine does make it into the baby's system and can affect their sleep, and you're going to want that baby sleeping. So, you know, you get a little bit more than when you were pregnant, but still be careful. They usually recommend you stop drinking that for your sake, for that baby's sake, after 2 p.m., no more coffee. Limit alcohol. You can pump and dump, but just be aware that it does take a while based on how much you might be drinking to get the alcohol fully out of your system. And then continue to watch the fish. High mercury fish, you want to avoid that because that can affect the baby as well. But a lot of the same rules apply post-baby, pre-baby, and during pregnancy.
All right, one last thing that I just want to touch on here is postpartum depression. Many new moms experience mood swings and feel some sort of, quote, baby blues after having a child. This is 100% normal. Your life has changed, and it can be extremely overwhelming at times. Your hormones are going crazy, you aren't sleeping as much, you're anxious about caring for a new baby, you may not have a lot of support from other family members, or you may have other children that are acting up because they aren't getting the same attention, lots of stuff going on. But most baby blues symptoms like mood swings, crying spells, weepiness, anxiety, and inability to sleep will be around for about 2 weeks or so after they start. But if you're experiencing these symptoms for longer than 2 weeks, or if any of the other symptoms I'm going to list here in a second, you may have postpartum depression. So those symptoms include irritability or hypersensitivity, difficulty concentrating, anxiety and worry, crying, tearfulness, anger, negative feelings such as sadness, hopelessness, guilt, loss of interest in activities you usually enjoy, difficulty sleeping, fatigue or exhaustion, changes in appetite or eating habits, headaches, stomach aches, muscle or back aches, or you don't feel bonded to your baby, which can be the most scary symptom really there is. You don't have to have all of these symptoms to be considered to have postpartum, and they may not show themselves right away. They can come even a few months after you give birth. But these are just some of the things just to be on the lookout for after that baby comes. Again, if they're lasting longer than that 2 weeks, that's kind of a signal for you to maybe look into it a little further. It can even progress to what's called postpartum psychosis, which can actually make you have thoughts of harming yourself or your baby. So if you feel like you have any of those symptoms, like I said, or you feel like those baby blues just aren't going away, see your doctor, especially if they don't fade after that 2-week mark or getting worse, make it hard for you to care for your baby, make it hard to complete everyday tasks, or include thoughts of harming yourself or your baby. And one thing, just to be clear here, one thing that having these symptoms does not mean that you do not love your child with all of your heart. There are outside factors going on, and this condition does not reflect what kind of parent you are or that you don't feel the same love as other mothers feel for their children. Also, this isn't something you can't just snap out of or power through. It's caused by hormones and other physical things. It's not a completely mental battle that you can just get over. So what can you do if you're feeling this way? First thing, like I said, talk to your doctor and get help. Your doctor can decide if they want to put you on a small form of medication to just kind of help reset things. Other things you can do to help yourself after you talk to your doctor are just be good to yourself. Do your best to sleep and eat as well as you can, and again, get in some activity if it's possible for you, but don't expect too much of yourself. Every mom wants to be that super mom and do everything for themselves and not ask for help. This is too much, especially if you aren't feeling like yourself, if you're having some of those depression symptoms. Ask for help and support from whomever you need to. Family, friends, anyone that can lend a helping hand to watch the baby, help around the house, bring you meals, or just simply to talk to. Which brings me to that next point, share your feelings. You need to talk about how you're feeling. Again, this can be with your family, your doctor, anyone you feel comfortable with sharing. But just get them out. It's going to make you feel better. And you may find that you aren't the only one who has gone through it. Many new moms don't want to admit they had postpartum depression or anything like that, but so many women, I think it was 1 in 8, struggle with postpartum depression, and we need to acknowledge it so we don't have to go through it alone. You don't have to be embarrassed because it's a completely normal thing to go through. So I know we kind of ended on a negative note, or not a negative, just kind of a depressing note, but let's just make sure that you know that having a baby is a wonderful thing, and being healthy before, during, after pregnancy will make the whole experience just that much better. And use a little humor to get through those rough spots. You know it's not going to be perfect, but you know, enjoy it. They're only going to be little for a little amount of time, and just have fun with it. We're always looking for your feedback and to continue to come up with new topics to bring to you for these webinars. So you can email us at healthcoach@healthcheck360.com. We'll have this webinar and past webinars. We're having some technical issues, so bear with us with the blog, getting some of these recordings up. But we are trying our best to get them up there, and you can find those healthcheck360blog.com. You can follow us on Twitter. Healthy tips and things like that available, and you can like us on Facebook. Pretty short on time here, so give us a shout out. You can email us, healthcoach@healthcheck360, if you have some questions from today's